Hello, welcome. If you're just joining us, I'm just going to give a moment to let everybody connect to the webinar. We're so happy that you guys could join us today. Just give it one more moment and see our numbers ticking up here. Thank you guys so much for joining us. All right, what a good crowd we have today. Thank you guys so much for participating. This has been such an very engaged audience, this virtual conference, and it's been wonderful. So I'm going to go ahead and get started because it looks like most people have connected. Welcome to our 2025 Self-Direction Virtual Conference Series. My name is Molly Morris, and I am a Vice President at Applied Self-Direction. Thank you so much for joining us this is our now 8th session in the conference series entitled Behind the Curtain, Understanding State Administration of Self-Direction. I'm just going to run through a few quick housekeeping tips before we get started. So just due to the number of attendees that we have on the line today, your microphones have been muted and will remain muted. There is a toolbar at the bottom of the Zoom window with a few options that you can use throughout the webinar. So there is a react button that you can use to submit reactions or emojis throughout the presentation. We always like seeing those fun emojis letting us know that what we're saying is helpful. Oh, I love that heart. Thank you. You can also submit questions and comments at any time during the session by using that Q&A button in the same toolbar at the bottom of your Zoom window. We have reserved time at the end for your questions, but we'll address as many as we can at that time. And then closed captions and translation are available for today's presentation. You can access the closed captions by clicking on the CC button or choosing Show Captions. This session is being recorded and it'll be available on our website as well as any slides afterwards, but we're not many slides for this one. The entire month of April is brought to you by our premier sponsor, PPL. So we appreciate PPL for that sponsorship. And a hallmark of the Self-Direction Conference is graphic facilitation recordings. Tempest Unlimited has graciously sponsored Inky Brittany to capture a fantastic drawing of today's session, which we'll be sharing on our social media. So thanks to Tempest for that. And we would absolutely love to know who's in attendance today. So we went ahead and popped up a poll on your screen. If you can just take a moment to let us know who you are. You can already see some of you interacting with this. And with today's topic, I'm especially curious to see who is interested in participating. Give it just a moment. You can see everyone busily responding. It looks like we've got a nice, our top attendees are FMS providers, case managers, and state staff. We've also got a great share of people who are friends and family of somebody who self-directs, or some of you self-direct yourselves. Couple of direct care workers, some support brokers, some advocates, small number of folks that work on the software side, MCO side, and then those of you in the other category. I'm often in the other category, so I see you. All right, I'm gonna go ahead and wrap up with that. Great. Thank you guys so much. So for today's session, I'm really grateful to be joined by two wonderful state administrators. I'm going to let them introduce themselves in a minute, but I just wanted to say that, for this session, we really wanted to do something that is really about understanding kind of what are the different variables and dynamics that state administrators are contending with. I know working in applied self-direction, I've been in a position a lot of times to kind of be either moderating meetings or being a fly on the wall where you've got folks that are in the advocate position. Getting to witness them really talking to state administrators, making their case. And I feel like over the years that I've been working in this field, I've seen, incredible advocacy in action. And I've also seen times where, there are advocates who have really important goals that they want to achieve. And sometimes knowing what I know about the behind the scenes with a state that I'm there on the call, I see like, oh no, something's not landing. There's kind of what the advocates are asking for. I understand why the state can't answer them, or there are challenges that come up that sometimes because of the unique position I'm in, I understand where everyone's coming from, but not everyone's aligning. And I feel like today's session is really about helping to bring advocates into alignment and better understanding how to navigate really partnering effectively with state administrators. So I'm so grateful to Becky Thomas and Jacqueline Grant for joining me today to have really a conversation about how to partner with state agencies around self-direction. And I'm really looking forward to this discussion. So to start us off, I'm going to ask Becky to just introduce yourself and tell us a little about your program.
Sure. Thanks, Molly. Hi, everybody. My name is Becky Thomas, and I work with the state of New Jersey in the Division of Medical Assistance and Health Services, also referred to as Medicaid. I wanted to give a brief update or a clarification of what our program looks like. So when we move into our discussion, there's some clarity around the program that we offer. I did want to note that the elements of information I'm sharing are more just to provide a quick landscape of our program. So next slide, please. So this is our background in history. We have been offering cash and counseling as part of self-directing since 2008. We were approved for a 1915J state plan amendment, and that's available to our folks that are enrolled in state plan services, and the program we refer to it as Personal Preference Program, or PPP. In 2014, we added PPP to our 1115 demonstration for individuals that were enrolled in Managed Long-Term Services and Supports, also referred to as MLTSS, and we have been providing services to our members for over 23 years. Next slide, please. This is, as it says, just the facts, ma'am. This is our current population. We use both budget and employer authorities. Our model is an FMS, a financial management services model, and we offer information and assistance services. Our population that we serve are state plan members receiving personal care services. To clarify, that does include our DDD members. And we have the waiver services for our MLTSS folks. And our payers, we have 5 managed care organizations, and we also offer a fee for service. So that's just a quick picture of our program. If you have any questions or follow-up, this is the way to give me a ring directly. You can visit our webpage or give us a call at our hotline. And part of, as a reference, for anyone that's interested in beginning an advocacy process or learning more, highly recommend visiting the Administration for Community Living. They're just full of resources, opportunities, clarifications about where to start in your own state. So thank you, Molly. Appreciate the opportunity.
Thanks so much, Becky, and thanks for being here. Jacqueline, you want to tell us about the programs that you're involved with?
Yeah, so my name is Jacqueline Grant, and I work for the Department of Developmental Services in Massachusetts, and I am the statewide director of self-directed service models. In Massachusetts, we have 2 different self-direction programs. We have the participant-directed program, and we have agency with choice. So similar to the program in New Jersey that Becky oversees, the participant-directed program is an FMS program. So we have a fiscal intermediary or a financial management services. There's many names for them. So they act as the human resource center for the participants and their family members. With the Agency with Choice program, the agency takes on that role, and the staff is actually hired as a staff of that agency. Although the participant and their family members or their support circle do get to interview and choose the staff that they work with. So they do still have choice and control, but they have a little bit more support from the agency. We also offer information and assistance here in Massachusetts, but we offer it in a little bit of a different way than some other states, as I've been discovering. So our support brokers are state staff as well, and currently they are the information and assistance for the participant-directed program or agency with choice program. We are in the process of adding a new service to the participant-directed program called an independent facilitator, which will then take over or not take over, kind of complement the supports and services that your support broker gives you to provide that information and assistance on person-centered planning and self-directing and choice and control. So that's me.
Wonderful. Well, I'm so excited to have this dialogue with both of you today. And where I want to start is just by asking about how your respective programs approach stakeholder engagement. I know from state to state, this can look pretty different. And of course, as a best practice, we want to see good stakeholder engagement happening at the state level. So Jacqueline, you want to tell us about how you guys approach this first?
Sure. I want to start off by saying I do think this is definitely an area that we can do better in, engaging more and getting feedback from stakeholders. But we do have, we have been working on it, and we do have a self-determination advisory board, which is made up of participants, taxpayers, regulatory agencies, advocates, family members of people who self-direct their services. So it's a pretty well-rounded group. And we meet on a quarterly basis. And what the board kind of was established for is for them to provide guidance to the department on some of the larger projects that we're working on, some of the bigger initiatives for self-direction here in Massachusetts. And also, we just went through a big transition. We changed FMS providers. So the advisory board was supportive in that as well, and providing feedback. The other big project that we're working on that the advisory board is very much involved in is we are adopting the supports intensity scale assessment for adults here in Massachusetts. So they have been working closely with us, HSRI, and I should probably say this, AAIDD, who is the organization who created the SIS assessment. Along with our advisory board, we do hold focus groups. We also have regional self-direction managers. So in Massachusetts, we're divided up into 4 different regions, the state is. And each regional self-direction manager hosts info sessions, community advisory board meetings. They don't host those, but they do attend them. And we also have parent support groups set up for each region. They are all virtual at this point, which has really made it a lot easier, I think, for us to connect, because driving, getting somewhere, trying to find childcare or, care for your adult child who can't be left alone. So I do think that it's really helped with the engagement. And about two years ago now, because of advocacy, we decided to create a handbook or toolbox for the participant directed program, because it is a little complicated. So we did include individuals who participate or who self-direct their services, their family members, advocates, DDS staff, in that work group to develop that toolbox. And we have gotten great feedback. So I definitely think it is a valuable part of what we do, because you all, as users or self-directors, have that lived experience. So, we're over here administering it and making sure we follow rules, but we love to hear from you all who are self-directing and what we could do to make things easier or more accessible or more forward-thinking.
That's great. And Jacqueline, we actually had a quick question for you, just follow up on what you were saying. The question is, as I assume almost all residents of your state pay taxes, could you explain the selection of taxpayers for the advisory board? Thanks.
Sure. So it's usually somebody who is connected in some way to somebody who self-directs their services. I am newly kind of appointed to the board. I've been going to the board meetings and taking minutes. So I will get back to you on the exact details on how the selection process is, but from my experience, it is typically somebody who has some sort of tie to somebody who's self-directing their services or who may have been advocating in that area and wants to be involved in the evolution of self-directed services.
Great. Thank you so much. Becky, do you want to go ahead and speak to how you approach stakeholder engagement in New Jersey? And then a couple questions have come in that you might want to address related to New Jersey as well. I can read those to you after if that's helpful.
Okay, sure. So for New Jersey, I'm gonna, got to put it all on the line. As far as the Medicaid delivered program, we did not really have a stakeholder advocacy community until a few years ago, when the EDV mandate came through for New Jersey. We knew that self-directed community members would be impacted because that was a requirement of the implementation. So we created a monthly work group to talk with the folks that use the services, their family members and authorized representatives, caregivers, our health plans participated, and our FMS provider. And it was an opportunity to begin dialogue and then learn how each person interacts with the program, what our strengths and weaknesses are, and how we can apply those different skill sets to a program that nobody really wanted to happen, I'm being perfectly honest. But through that experience, we created a community. And from the EDV implementation, we now formally meet every quarter with the same group of folks. We're always looking for new members, and we review current policy, how EDV compliance is working, where we're having challenges. What are your thoughts and your feedback? Advocates as we know, can be lived experience. We have folks that provide support. And then we also have our administrative partners that also bring that information to us. Through that quarterly meeting, we use that as a jumping point for our current FI transition that is occurring in New Jersey for PPP members. And we have now created a community-focused work group to help us design and draft communications for members, making sure we're using appropriate terminology, that it's clear and readable, that the details are exactly where they say they need to be. And we work with our health plans to make sure that we're all on the same page with this process. So something that was not necessarily a positive at the start with EDV implementation has now helped us build a rapport and experience with our advocates. And there's less of the, well, what's going on? We're now giving you that information. We've updated our webpage, and we're trying to get as much information out there to our community. And our advocates have been a tremendous support of that effort. So thank you.
Wonderful. And actually, Becky, quick follow-up questions for you. Somebody was asking, I'm assuming the K was a typo and there are 38,350 people in PPP in New Jersey, not 38 million. How many people total are getting LTSS in New Jersey?
38,350 people access PPP in New Jersey.
Great. And then on regard to the MLTSS side of things, who contracts with the FMS in your state? Is it the MCO or the state? Who sets the allocation? And if it's MLTSS, what guardrails are in place to make sure they're giving adequate allocations?
So great question. So when we're talking about our managed long-term services supports, we are identifying that they are enrolled in managed care. So that's a key component. And currently we have one FMS, which may be changing in the future, but currently we have one FMS who is contracted with the state and has master services agreements with the health plans. So we all kind of work, I call it the triangle of processing. So we work it all together. When someone is enrolled in MLTSS, there are also federal requirements that must follow that waiver program. And many of them are the best practices for how New Jersey provides services. So even if you're not enrolled in managed care, everyone needs clearly an assessment, which is based on our state's approved PCA tool. And that information is then used for creating a budget and preparing services that meet that person-centered expectation of care. And while the waiver has shown us the way, that's the way to do it. We try to mirror those particular supports around our folks that may be only receiving state plan at the moment, but PCA can be a predeterminant of managed long-term services supports long-term. We do anticipate that PPP is built into every plan of care where appropriate, and there are assessments annually, not only for PCA, but also for long-term care, communication about their plan and how many hours they are approved for, who their workers are, et cetera. So we line all of those pieces together. And again, that has been our blueprint for how to implement PPP for folks that are not enrolled in a waiver with those specific requirements.
Great.
I hope that was helpful.
Thank you. So, the next thing I just want to ask about is from each of your perspectives, I'd love to know what you feel like effective advocacy for self-direction really looks like. And do you have any specific examples? Jacqueline, do you want to maybe speak from your experience in Massachusetts first?
Sure. So I think that it's really important. It's a really important relationship that the department has with the advocates, who again have that lived experience, and really just remembering that we are partners in this and we all have the same goal. We want to push self-direction forward. We want to make sure that it's accessible, equitable, and available to anybody who's interested in making that a possibility for folks. I think that in Massachusetts, legislation has been really key in pushing self-direction forward. Back in 2014, we had the Real Lives Bill passed, which promotes training for department staff on self-direction, in addition to providing information to all people who get services from us about self-directed services. It also promotes transparency, consistency, and equity, accessibility, person-centered planning, and the growth of self-directed services. So it's pretty much an all-encompassing bill, which is where that independent facilitator service actually originated from. In the bill, it is a requirement that we provide independent facilitator services to people in self-direction. And I think the biggest project, the most recent project that we've been working on with advocates and the Self-Determination Advisory Board is that SIS assessment. We are also working with Human Research, HSRI, I'm just going to use acronyms, Human Services Research Institute, to develop a support need level framework for budget determination. So that gets at what the Real Lives law states about equity, transparency, and consistency. One of the biggest things that we hear about from advocates, family members, participants is that if you go to one area office, you get a completely different answer than if you go to another area office. So we are aware that consistency is something that we definitely need to work on as a department. And this SIS assessment will definitely push us in the right direction in making at least the budget development process for people in self-direction. And eventually we plan on rolling it out to everybody who gets services. But at the moment, we are focusing on those in self-direction to create a more equitable and consistent budget development process for everybody who's interested in self-directed services.
Thanks, Jackie. Becky, how about in New Jersey, what do you see as kind of effective advocacy for self-direction looking like?
So for us, it's there are eyes and ears, they're the voice, they are the lived experience. So their feedback and input is 100% necessary. This program is for them. So we want to understand how it, the rubber meets the road in real time. And I really appreciate that the advocates that we have come from different areas of the health plan experience, meaning some folks receive services through DDD, some folks receive services through MLTSS, and everyone has a different point of view. And we need to understand how all of these decisions that we make impact that either subset population and the program at large. I will say that the willingness of our advocates to educate us and collaborate with us, as well as our FMS vendors and our managed care organizations, is irreplaceable. We can't do this without them. And making sure that we've created opportunities to invite advocates to the table and assuring that we're putting information out there, asking our advocates to push out information to folks that maybe we don't have a direct link to. They keep us, I would say, respectfully in line. And that if we're missing someone, if the language we're using is not relatable, if our approach is impactful in a way that can be negative or positive, either way, there's honest feedback, the communication is clear, and that has been a key element in how we've moved our program forward, how we've been able to increase enrollment, and making sure that we're constantly holding ourselves to that standard and expectation from our advocacy partners. A lot of our work is done in coordination with other divisions and other programs. So without them, that's where the gaps fall, right? That's where we find the information falling through. So like I said, we would be lost without their input and support.
Helpful. You know, I kind of talked about this at the beginning, but what kind of advocacy approaches have unintentionally made it harder to implement positive changes, or maybe haven't succeeded as intended? Do you have any examples of that? And Becky, why don't you go ahead?
Sure. So I prefaced it in my first response around our EVV work group meetings. I don't want to speak for how other states experienced this, but in New Jersey, there was a lot of pushback from the community, from advocates, and additional community stakeholders. There was frustration and questioning, why are we doing this? Why are you making us do this? So it was understanding and listening to that perspective, while also understanding that this is a federal mandate. It wasn't a decision that New Jersey made lightly, and that we wanted to find a solution that could meet members where they are and align with the mandate. So while at first it wasn't great, there was a lot of questions and a lot of frustration. But as we continually met, provided clear expectations, updated as changes went, we used a pilot implementation model so that we could view its successes in real time with the community. And that definitely helped with getting more buy-in and understanding that we're not here to be, I'm going to use this phrase with quotations, big brother. We're here to make sure that program integrity is maintained, that services can continue so that there's clear understanding of how it's being used and utilization. And it's also a way for us to better understand how to approach challenging issues like this in the future.
Yeah, that makes sense. Jacqueline, what about in your experience, any advocacy approaches that maybe haven't achieved what they intended to achieve in the past?
Not necessarily approaches, but one thing that is a struggle for the department, and in all honesty, the people who get services from us, is advocates being knowledgeable about the current services that are provided in self-direction. They may have information that's out of date. They may have, not heard about the latest changes. The other thing that makes it challenging is, advocates work with multiple different people and multiple different families, and everybody is unique. Everyone's different. Everyone has different support needs. Everybody has, different levels of support that they need, and what may be appropriate, or I guess appropriate is the best word, for one person may not be appropriate for the other person. And so we've gotten, it's made some of the relationships in the local area offices contentious. So it really does, it really does hinder us making changes, or making sure that we are consistent. We can only be as consistent. We can only be so consistent because, like I said, everybody is different and everyone has different needs. So there is going to be some differences. So I think understanding that, somebody who may qualify for a 24-hour residential program and chooses self-direction may get different services, or may be approved for different services than somebody who is going to college and just needs some support on campus to get connected to their disability office. Maybe they need some support in taking notes or doing, projects, executive functioning. So those are two very different individuals. And so the same rules don't necessarily apply to them. So I think that's been something that we've struggled with here in Massachusetts, and I'm sure everywhere else, because we're helping people, and people are different, and they all have their, they all have their needs, and those are different as well.
No, that makes sense. That makes a lot of sense. I was mentioning earlier that each state is different in terms of the level of stakeholder engagement that state is engaging in related to self-direction. I'm sure there are some folks who are listening today who are in a state that is kind of doing bare minimum in terms of stakeholder engagement. Where might someone start if they want to push their state to do better at responding to their feedback? And Becky, why don't you go?
Just had to take myself off mute there. So I thought this is a really helpful question, because especially if you're new to a state or new to receiving services and you're not finding the support or a community, a connection, I would say it could be something as simple as reaching out on a social media platform. Are there area discussions going on, or perhaps a networking platform? If you participate in anything related to that, you can definitely find folks in your area. My other suggestion is to search what required advisory councils exist in your state. So each state, you can put that information in a Google search and see if there is a meeting that is occurring that you can participate in. Is there a meeting that pertains directly to you and your experience? Are there a couple different areas? And then I would also recommend anytime there's an opportunity that you hear about participating in some sort of a meeting or discussion, show up. Every time you show up, that gives us it puts that human experience to a person. So we're not talking like numbers, we're talking humans. And another way that you may see what is happening in your state or nationally is, I noted it at the beginning, search in the administration for community living. That's they have supports for federal and state level issues. You can look up all different types of opportunities that may help you find something local to you to get involved in. I find that all of those areas help us find out who we should be contacting to if we're not hearing from them. And also if finding groups like Applied Self-Direction, not a plug, but a true reality of available resources to learn more about what is out there, what needs to be out there, and how to successfully create dialogue around a change that needs to happen or is happening that doesn't work. So those would be my recommendations if you're getting started.
So thank you, Becky. Jacqueline, is there anything you would add to that?
Mine are pretty similar to Becky. The one thing that I would add is here in Massachusetts, we have an ombudsperson for the department. And they are very effective in reaching, getting the area offices to reach out to the family, provide more information, and just kind of move things along in the right direction. So you can definitely reach out to the ombudsperson for the department if you feel like you're getting stuck at the area office. As I mentioned earlier, we do have what we call support brokers, who are state staff, and we have at least one in each area office. Some have more, and I think starting there, because they're your person at the department. They're the ones who are going to get services in place for you, advocate for you. Really, they're the ones who are going to know you and your support needs the best. So they will be the best advocates kind of on the inside, as far as the department goes. So really utilizing those support brokers, social media, like Becky said, I think is a great resource. We have many different social media groups that participants and families start, and that's used for networking, it's used for getting answers, it's used for connecting with other folks who may have the same situation or may be going through the same problem with mass health or with SSDI. So it's a great kind of networking tool. And our local area offices, not all of them, but some of them do offer networking opportunities for participants in self-direction to get connected with each other, share ideas, and provide that feedback to the area office on how they think they're doing in overseeing self-direction.
Great, really, really helpful. Another dynamic is that you're both administrators of self-direction programs. So you're in those programs day in, day out, but there are a lot of other folks in state government who are very loosely related to the self-direction program, but are maybe important decision makers. How can advocates help you build the case for self-direction improvements with other decision makers in state government, particularly those decision makers that maybe don't understand or support self-direction? You guys obviously support self-direction, but sometimes there are decision makers that just don't know the model as well as we all do. Becky, why don't you go ahead and tackle that one first? Oh, and you're muted. A tale as old as time.
I was going to say, this is a daily occurrence where I usually go, because I'm talking. So, one of the first and foremost thing is share your story. Make sure that to whatever extent you're comfortable, or someone that you're advocating on behalf of is comfortable, bring that experience into real time. Change, especially in the programs that we work in, we help people day to day in live the choices that they are making. And whenever I tend to find that we serve as an advocacy office, I'll put it that way. So the Office of the Consumer Directed Services, our team is an advocacy office on behalf of our participants and their families, their workers, and how we can make sure that, I would say, policy creep is appropriate and re-educate as often as possible. I know that from my experience, there are often times where I have to give the same information time and time again, because self-direction is unique. Even though I say this firmly with belief that this is our future with healthcare long term, a lot of folks still have misconceptions. So much of that is understanding where how to myth bust, provide clear evidence, and follow policy, because it does give us that structure, that ladder of expectation. So it's our role to make sure that we're clarifying that, yes, I understand this decision here, but do you understand how it impacts this person's individual experience that they are sharing with you? Make it real. And it is those experiences that change minds. I can say that with a firm assertion that is really impactful. So would be my recommendation, to at least get change moving in your area.
That's great. I agree with that completely. Jacqueline, what else might you add?
I just want to echo what Becky said, just bringing it back to the person. You know, a lot of us in state government just see numbers and statistics and don't really take into consideration the person that's behind those numbers or behind those statistics. So I really do think that advocates have that, you know, I think a lot of, in Massachusetts, a lot of the folks that work for the department do have personal lived experience, you know, supporting somebody with a intellectual disability, autism, but there's some folks who don't. So I think that advocates play a really strong role, and they're the ones, again, with that lived experience. They're seeing the impacts of you know, the changes in self-direction or the lack of changes in self-direction and how it's impacting the families that they're working with, the individuals that they're working with, their loved one. You know, you don't really get into advocacy for nothing. So again, these advocates that are out there also have that lived experience of growing up with a parent, a sibling, a cousin, an aunt, and uncle, you know, so just bringing it back to the person, I think, is really important, and is much more impactful than, you know, the department or other state government coming in with all these numbers and statistics and saying, well, we suggest this because of X, Y, and Z. It really is all about the people who we're providing services for.
Awesome. Awesome. Totally agree. Um, what do you both wish more advocates maybe understood about some of the constraints that you face when administering self-direction programs? I think sometimes, you know, as advocates, we wish things could happen much more quickly than they can. Or can you speak more to sometimes what's happening behind the scenes? And Jacqueline, why don't you take this one first?
Sure. I think the biggest thing is we are held accountable for how we spend taxpayers' dollars, and taxpayer dollars do fund this program. So, you know, there may be some really creative ideas out there that we can't necessarily see taxpayers being comfortable with. It's something that we struggle with. We may agree with what's being said, but we just know, you know, with in all honesty, the bureaucracy and the red tape that we encounter, that it just won't be possible. So I do hope, and I'm just speaking for myself, I do hope that that doesn't come across as us being heartless or not caring. We really do care deeply about the people who we provide services for, and it's personally very upsetting when we can't make something happen for the individual in self-direction. And we may not agree with the decision all the time that's made, but we do have to go along with it. The other really fun stuff is the waiver and requirements and rules related to the waiver. I'm certainly not an expert on the waiver, nor do I expect any mom, dad, individual, brother, sister to be an expert on the waiver. So there really are some kind of guardrails and parameters that have been put in place through CMS that we don't have any control over. And it's been a real struggle for us to get people to understand that these aren't the department's rules. These are, you know, federal waiver rules that we have to follow. So, you know, I guess I just want people to know that we're working with you. We're really not trying to work against you, even though it might seem like that sometimes. We really are all in this, you know, to make the best quality of life for the individuals who get services from us.
Awesome. Thanks, Jackie. Becky, what about your perspective on this one?
So I agree 100% that sometimes we're sitting in a position where we are being asked to manage a process a certain way based again on requirements, either from the federal point of view, from the state point of view. And when we're having those types of discussions, I just, again, want everyone to know that we're all here with one understanding. We're here for this service delivery model. and its ability to drive decisions based on a person's needs. And when bureaucracy comes through, it's that understanding that even if you're not in the room, we are advocating on your behalf in that room. Jacqueline said it very profoundly. It may not feel that way, but please know that when there is a situation or a policy touch point or a requirement that is created outside of our area, it's our job to make sure that the community experience is clear in our responses and our reactions and our follow-up. For example, you may have another division in your department that wants your program to implement something because of their point of view. That's valuable insight and a valuable point of view. However, when you make those types of recommendations and or expectations, we have to go back, know the policy, know the program, know our community to say, I hear where you're coming from, but that is not relatable, that is inappropriate, and that is overreach of people's ability to make their own choices, which is what this program, these different areas are for. So making sure that we're agile when we're talking about policy and where the rubber meets the road, where I said that how many times? There's a lot of rubber on the road today. But there, it's how these policies and these expectations are experienced in the real world, as opposed to, we think this, and this is why, and do it. I will say that it doesn't necessarily always make me popular when I push back and say, no, this is not something that we're going to do, and this is why. How can we find a compromise? How can we meet in the middle where we're respecting dignity, choice, and service driven by that one person? It means something to that one person. You're looking at it in aggregate. We're talking about human beings, and we have to keep that clear every day in every conversation with anyone that we coordinate with. So keep us informed, keep us educated, so that we can do the same when you're not in the room and we are advocating on your behalf. That would be my ask.
Great advice. I want to make sure we spend a good amount of time on the audience questions. We've gotten some great ones. So let me read the first one out and get your thoughts on this. So one person says, in our state, provider agencies and their lobbying organizations sees self-directed services as a threat. Our rates have been frozen for 2 years, while the lobbying efforts of providers have been successful in gaining 2 rate increases. About 750 of the 3,500 self-directed services users are loosely connected, but we cannot afford paid lobbyists. Despite our efforts to educate lobbyists and our delivery of individualized care at a cost savings to the state, the need for our direct service providers to have rate increases is not acknowledged. Do you have any suggestions? So Becky or Jackie, thoughts on this one?
You want to hop in, Jackie? I can follow you when you're done.
Sure. So here in Massachusetts, we do have Chapter 257 regulated rates for agency providers. And those caps for specific services like home supports, respite, adult companion. I'm not going to go on, but there's some services that have rate caps, and the rate caps are the same as the provider rate caps in self-direction. You are allowed in Massachusetts to choose what you pay your staff, and in New Jersey as well. So I'm not really sure if your budget won't support giving your staff a raise, or maybe your state doesn't allow you to choose the rate that you pay your staff. But here in Massachusetts, we are pretty flexible, and you can give your staff a raise. Something that we are looking at doing in the meantime, while we're waiting for the SIS, is looking at, for day supports, we have a community-based day supports assessment called the CDAT, using that to kind of provide an equivalent amount for day supports and self-direction that somebody would receive if they're going to a day program or they're getting employment supports through a traditional agency to just support the same level of pay that an agency staff would get in self-direction.
Really helpful. Thank you. Becky, go ahead. You have anything to add?
So, sure. So New Jersey has actually been very focused on caregiver, direct service, professional rates, and there has been a lot of advocacy. I will say, with respect and appreciation, a lot of that has been driven by our DDD partners for our IDD individuals that are receiving care through that self-directed program. In New Jersey, we have a little slightly, for PPP, to clarify, we have, because we are both budget and employer authority, similar to what Jacqueline was saying, you can determine how much you want to pay someone up to, currently we do have a cap at how much you can pay at the moment, but you can pay no less than minimum wage. In New Jersey, under our current administration, have been raising the minimum wage from $10. We are now at $15.49. So one of my, we were talking about re-educating. I think I've had this conversation with my the great fiscal team, but it's hard to clarify that. Like, a lot of people are, oh, this is just like agency. It's not. It's not. We are also responsible for wage paying and what those expectations look like for the self-directed workers. So over the past few years, I consistently said, hey, as minimum wage raises and we don't change our budget calculation amount, meaning there's a dollar amount that we use per hour to help calculate the budget based on our calculation methodology. And that number was never changing. And I had been advocating and advocating and advocating and advocating. And then during COVID, we had the rescue plan funding. And I think it was like within seconds of getting that email, I was like, hey, fiscal, here's a golden opportunity. So I'd like to pay attention to see what programs, what new legislative requirements are out there, and how we can leverage opportunities to make sure that we keep our program viable. So we have increased our budget calculation amount from $15, and we are now at $19.89. That's huge in our program, but we kept sharing through clear calculations as the minimum wage goes up, and we don't follow along on the calculation. People will start losing access to services because their budget methodology isn't moving along with the wage increases. So that was a big push, and we did get legislative approval in our budget to pass that through, and it has been a major game changer. So I'm grateful to New Jersey for its focus and drive to keep our direct service professionals and family members, caregivers, on the right side of being able to offer these services and have an expectation that you can meet your bills and your requirements and feel respected and valued for what.
Oh, that's a shame. We lost Becky. Jackie, it's you and me. We'll have to keep this going. Hopefully Becky will come back. Oh, there she comes. There she comes.
Okay.
While Becky gets reconnected. Oh, there she is. Good comeback. That was quick.
It was like my entire system was like, no.
No.
Okay, yes. It was like, stop talking. So I'll take that as a sign to move to the next question.
Sounds good. So this is an interesting one. So as an advocate, this is the person's question, I have spoken with advocates from several US states and have also participated in the global self-direction network. And he gives a website, selfdirectedsupport.org. which is a great resource to look at. My observation is that there is a backlash pattern, which has been repeated in many places around the world. First, enthusiastic embrace by the government of the self-direction approach. Second, rapid growth of self-direction. Third, action by the government, creating new restrictions and putting in place new barriers to entry. Based on your lived experience in state government, what perspective or hypothesis can you offer about why this backlash pattern is so prevalent in multiple countries around the world? Really interesting framework. Curious if one of you want to tackle that one. Do you have a theory?
I have a theory that I'm willing to
I'll let
share.
you go.
Yeah.
Okay. So we're experiencing this particular item in real time. So part of that is managing expectations and growth of these programs, understanding that self-direction has been a game changer for a lot of people who need services and supports. And part of that push is there are like-minded, but other areas where growth means fraud or misuse. How do you get in front of that dialogue to state, I understand where you may get these ideas, but here are the facts. These are how things happen in real time. This is the reality of how we manage that, and making sure that we have to keep fighting for the rights of everybody that wants to choose this service methodology. And again, kind of how I stated it before, come with the facts, the policy, the metric, as well as the operations. All of those pieces are going to come together, and they're going to help innovate the program in the future for how you manage it. One piece that we're working on in New Jersey is our current FMS model follows, I refer, it's probably not the right way to refer to it, but as a pay and chase. You're constantly retroactively reacting. How can we take that and move it into a proactive process? How do we convey that? How do we provide the policy and best practices to make that shift and change? I can tell you most of my payers aren't thrilled about it, but we're making change in how we innovate service delivery, maintain appropriate payment methodologies that align with program integrity expectations. And then we just have to share and continue to share. Here's the evidence, here's the evidence, here's the evidence. This may be anecdotal, here are facts. So that's how we've been managing it so far.
Really helpful. Jackie, is there anything you would add?
No, I think Becky covered. I mean, I do agree with Becky's theory that it's probably people are scared that fraud, waste, and abuse is going to happen rampantly if this program continues. Sure, there are some people that will definitely take advantage of the freedom that this program allows and the choice that this program allows. But the majority of people in self-direction are really trying to just create a meaningful life for themselves or their loved one. So, where we do see it happen sometimes. I'm not going to say it never happens. It's really not as prevalent as people imagine it would be, or people think that it is. So I don't think it's a realized problem, but it's definitely something that's kind of ingrained in state government that, we can't waste money. We can't have people fraudulently billing. There's fraud in provider agencies. I mean, you can't have 100% fraud-free program, whether an agency is overseeing it or a mom is overseeing it, or a dad or a brother or sister. So I agree with her hypothesis. I don't really have anything else to add, but that would make sense if that's kind of the feeling that you've been getting while you've been meeting with the different advocacy groups.
It's really helpful. Well, I'm just looking at the time. I wish we could go on and on. This has been such a helpful, valuable discussion. Really appreciate you both, Becky and Jackie, for the time you've taken to be part of this conversation to share. It's a little more of a vulnerable topic, kind of talking from behind the curtain. So really appreciate you guys and appreciate everyone who was able to join us today and participate in today's session. So we look forward to next week's session, and thanks everybody for joining us today.
Thank you for having us. Take care.
Bye.
Bye-bye.